Did you know that the number one predictor of how long you'll live is not things like your weight, your cholesterol, your blood pressure, your exercise habits? It's something else entirely, which I think might surprise you. So starting in 1948, there's been a study called the Framingham Heart Study. It's followed generations of people since then to look at all things cardiovascular health and general health. And what they found was that the number one predictor of how long you'll live or your mortality is not things like smoking, like your exercise habits, cholesterol, blood pressure, those things. It was actually your lung capacity, and in particular your forced vital capacity, which is how much air you can forcibly exhale after a deep inhale. Now I thought this was pretty interesting, and when I see people in practice, and you'll see this a lot when just watching people, is a lot of people breathe into their upper chest. They're using these accessory breathing muscles, they get tension in the neck, and they're not using their diaphragm and breathing in all directions like we should do. So here's a simple exercise you can practice. When we sit there, we're going to breathe in through our nose. We want to make sure that our abdomen expands in all directions, not just poking the tummy out, but we want to make sure that the side expands, okay? So you can have your hands here to practice that. You can also place your hands on the bottom of your rib cage. And when we breathe in, we want to see if your rib cage expands in all directions. Now you can do this yourself. Even better would be to have someone behind you and place their hands on your lower rib cage, and when you breathe, see how much it expands, see if both sides expand or if it's just one more than the other. It's a really simple way to see, are we getting a lot of chest expansion? Now if you are struggling with chest expansion, sometimes thoracic mobility work can really help. There's things like your yoga exercise, the cat-cow, general thoracic mobility work. You might need to see someone like a chiropractor to help restore some motion to that thoracic spine and the rib articulations where they attach on, to really be able to get some mobility into that rib cage to help with this breathing capacity, because as the study's shown, it's so important. So it's well worth practicing this breathing exercise. I know there's tons of things out there online. You can have a look around at other exercises, but starting with the basics is always the best place to start. And I know if you try this, your body really will thank you for it.